What's the best treatment for hand arthritis? I'm going to describe to you what treatment is happening right now in this time in the healthcare industry. Number one thing you're going to get recommended if you go to the doctor is medications. They're going to tell you to take over-the-counter medications. The common ones are going to be Tylenol, aspirin, ibuprofen. There's just different kinds of pain medications. All of them are designed to help pain and then also to help inflammation. Some of them are anti-inflammatory drugs. These medications are only supposed to take the pain away for a short time, hours usually, and then the problem's gonna likely come back if it even touched it at all. Most of the time it's just taking the edge off. It's not going to take the pain away completely. Now, if the medications don't work, the doctor's next gonna recommend prescription strength medications, which is the same things. Usually they're just stronger versions of it. There's some other high power medications which the medical field is getting away from and using less. They're using it more judiciously, the opioid type medications. Those are for more chronic pain management, which could be you if you've had hand arthritis for years and you're not looking to have a surgery. More on that later. But if that doesn't work, then they'll recommend something like cortisone injections or steroid injections for the joint in question, the thumb or the fingers. The injections are medication that they're putting right into the joint that hurts. And they're anti-inflammatory and pain relieving medications. So they're taking away the pain, but also reducing inflammation. What you need to know about that though is that in the phases of healing, inflammation is the first phase. Inflammation needs to happen in order for proliferation and maturation to happen. Those are other phases of healing. And what's happening in inflammation is your body's sending a bunch of cells. There's a bunch of chemicals happening in that joint that's hurting. That's why it's inflamed, it's swollen and red and hot, because there's a bunch of cells coming to the area. There's a higher metabolism happening there, and there's healing properties happening. But if you never take away the problem, the reason for the inflammation, for the pain, for the stiffness in the area, then you're just in a constant inflammation mode. So getting an injection, an anti-inflammatory injection, is only going to temporarily relieve the problem. It's going to come back eventually if you don't fix the root problem of hand arthritis. So doctors are typically not going to tell you that this is going to cure it because they don't see it be cured by an injection. They'll just say this is going to give you some temporary relief. But instead of hours or a day, it's more like weeks, potentially a month or two, in some cases 3. Other recommendations that doctors will make is lifestyle adjustments, meaning they're going to say, well, maybe it's time to get that electric can opener. Maybe it's time to get that extra grippy rubbery thing to open those water bottles or those stiff caps or jar lids. Get those tools that make life easier, or get somebody to do your yard or to do the cleaning in the house so that you don't use your hands so much. They'll say things like that in order for you to reduce using your hands, but that still doesn't solve the root problem of hand arthritis. It's just delaying the issue because you're still dealing with the muscle imbalance that's setting up the increased pressures in the joints of your hand. And if you don't face that, then you're not going to get your hands back. You're not going to reduce the stiffness in the mornings when you wake up. You're not going to get better sleep at night. You need to fix the root muscle imbalance. If you go back to the doctor after having injections and telling them that you bought the electric can opener and the jar opener, all the tools to get more leverage, not have to squeeze your hands so much, and you're still there with your hand arthritis problem, what they're likely going to do at that point is send you to a hand surgeon, if you're not seeing one already, and start talking about surgical options for your hand. And surgery is done. There's even joint replacements done for joints in the hand, but they're not as successful as like hip and knee surgeries. And there's side effects, of course, and there's trade-offs, and you might have less pain, but not as much strength moving forward. So you have to weigh those options for yourself and decide if surgery is right for you. In some cases, before going to surgery, they might send you to do physical therapy or hand therapy, in which you'll be doing putty exercises and using all kinds of little tools to strengthen your hands. And the idea is that if you get stronger hands, you should have a reduction in your symptoms of hand arthritis. However, the way that you strengthen your hands is very important in my opinion. I believe that there's certain muscles that you need to strengthen in order to fix the muscle imbalance. And most physical therapy places that are helping somebody before surgery are not prepared to help somebody like this. Most physical therapy places, especially hand therapy places, because there's specialized places for hand problems, they're seeing people after surgery. They're seeing the person who had a hand arthritis surgery or some traumatic injury to their hand, and they had a tendon reattached or a finger reattached, or some severe trauma was surgically affected, and that's what they're going to the clinic for. But if you're the person trying to avoid surgery, the therapists there are typically not prepared, and they're not going to know what to do with you. They're going to put you to the same exercises that all their post-surgery patients are going through. So you're going to see them doing putty exercises that you're going to find kind of easy. Simple range of motion exercises like this, or where you're doing this right here, that you can kind of do already. And you might even find that some of these exercises immediately aggravate your problem. Or if they don't aggravate it immediately, maybe in a few weeks it becomes more painful. The reason for that is because they don't know about muscle imbalances. That's not their training. Their training is to help people after surgery, and they're pretty good at that. You need to fix that muscle imbalance. And that's why the best treatment out there, I think, for hand arthritis, if you're avoiding surgery, is the Hand Arthritis Recovery Program. This is a program that I've developed. There's a link to it in the description below. I developed this program to fix the root muscle imbalance that sets up hand arthritis. To put it really simply, there's muscles that close your palm. You see how my palm gets a little crease in there? And there's the muscles right here and right here. And then there's muscles that close your fingers. When you go to grip something, you should be using a combination of both. You should have a balance between the two. But most people that have hand arthritis are very weak in their palm muscles and very dominant with their finger muscles. And so they do most activities with their fingers. So it doesn't make sense to go exercise your fingers a lot more in this case, because you're just going to make the problem worse. You're going to perpetuate hand arthritis. If you can instead focus on fixing your palm strength and not using your fingers, then you're going to be in a position to heal your hand arthritis problem at the root and get to a situation where you're not as stiff in your fingers. You're not getting as painful. It's not as hot and red and swollen. And you're able to pick up things that are heavier. You're able to do repetitive tasks like writing, typing, the simple things that you should be able to do every day without worrying about your hand arthritis getting worse. So this is the best treatment out there, I believe, for hand arthritis, to avoid surgery and get your life back and get back to doing those simple things that you love to do. Gardening, the laundry, cooking a meal. Those are things that you should be able to enjoy your entire life, but it comes back to fixing the root muscle imbalance. If you want more help with your hand arthritis, I made a video with 8 things you should avoid doing if you have hand arthritis. The video's right here. Go check it out to learn more about how to help your hand arthritis and stay healthy.